Hi, I'm Alisia Bell, here with Health and Wellness, and we're at Restore Physical Therapy in Marlton, New Jersey, with co-owners Troy Hofmann and David Huttinger. Gentlemen, thank you for being here today.
Thanks for having us.
Thanks, Alicia. We really appreciate speaking with you today.
And today we're going to talk about preventing falls and some tips and tricks you can take to prevent injury from shoveling the snow this winter. So guys, what are the more common injuries you encounter on a daily basis?
The most common injuries that we have with falls, particularly a lot in the elderly, are fractures of the hips and wrist fractures.
The other thing we also have to be concerned with, we see this in a lot of the younger population as well, but we don't think about in the older population, are concussions, and that's something we also deal with on a basis depending on what type of symptoms they might have as a result of a fall. A lot of times it's missed, or because they have a fracture or other issue that might be more apparent, but a lot of times the concussion is also our concern.
And how often do you treat injuries in the elderly due to falling?
Well, one of the statistics out there is, and not to bore you with statistics, but over the age of 65, about 1/3 of those people are going to fall within a year. And of those that fall, actually about 50% of those are going to fall within 6 months. So, unfortunately, it is a common occurrence that we see, but it is very preventable.
Are there any risks with this from falling?
Oh, the risk. There are risk factors.
Yes.
Yes. One of the risk factors is depending on how many medications. A lot of the elderly are taking more than 4 medications, and that's one of the major risk factors. Another risk factor is they're taking a sedative or tranquilizer. That obviously affects their coordination, their reaction time, and their ability to prevent a fall. Another one is postural, or we call hypotension, is when they change positions. If they're laying down, or especially at night, a lot of our patients we see have falls at night because they're laying down and all of a sudden they have to get up to use the facilities, and they get up and they feel lightheaded and they feel the urgency to get to the bathroom or something like that, and they tend to lose their awareness and balance and everything. The other thing we have is strength and mobility. That's a big issue with our older patients, and we see most of our older patients, they get hunched over, they lose the mobility in their ankles, their hips, their spine, their neck, and so their ability to react and make those appropriate adjustments are affected as well. The last thing is a lot of these people have difficulty with transfer. So if somebody has difficulty getting in and out of bed, getting up and down from sitting, they use an assisted device, anything like that, those are warning signs that we look at that potentially will cause them to have a fall in the future. So,
on an average, how long does it take somebody to be rehabilitated to regain their strength from a hip or wrist or concussion or any kind of injury like that?
Well, the hip's a major concern with falls in the elderly, especially over the age of 65. About 90% of all hip fractures are because of falls. And one of the things that is a statistic out there is 40% of all nursing home admissions are because of falls. So it is a big concern that we have. And, a general healing of a fracture is 6 weeks. But then on top of that, there's that thing that phrase out there that for every week that you're down or immobile, it takes 3 weeks to rehabilitate. So, it can be really depending on what factors people have. Do they have diabetes? Are they obese? And a lot of that can contribute, but you can be looking up to 3 months or even in some cases over a year.
yeah, another thing I want to add to that is that a lot of times these patients have a lot of other issues on the table, and so when they have a fall, they might have a fractured hip or fractured wrist or something like that, but they might have all other issues that they've kind of been ignoring over the years, and we talked about loss of motion and strength deficits, and those things can definitely add time onto the time period at which it takes for them to rehabilitate. So
how can these falls be prevented?
Well, there are 3 easy things that people can do out there to try to prevent falls. But when we talk about prevention, it's one of those subjects that most people don't really look about prevention until after it happens. And it doesn't matter if it's a fall or if it's a knee injury or thing, but that's the biggest problem. So the 3 main things that we want to get out is, number 1 is, and Dave talked about medications, see your family care physician or your primary care physician on a yearly basis. Have them check your medications. A lot of times people get hospitalized, they get readmitted, and each time they go in, the doctor will add medications to that person. But there's a confusion. Do I add that to my other medications, or do I subtract some, and they don't know? So they end up being over-medicated, which then can lead them to being a little bit fatigued and going in there. The second thing Dave talked about a little bit was vision. If you don't have your vision, or you're losing your vision, things that may look like it's a little bit closer or farther, they don't really appear that way for you, and you may reach for something and it be a little bit too far, which throws you off of balance. And lastly, where we come in as physical therapists is get out and get a yearly checkup done. You know, we're going to talk a little bit, and Dave talked a little bit about if you have loss of strength, if you have loss of range of motion, it leads to your decrease in your mobility and how you get around. And also your balance. I mean, we can do 6 tests in under 2 minutes in a fall prevention screen to find out if you're at risk for falling or not. And if you really, don't go out and do any of those 3 measures, you're significantly increasing your risk of falls. And the point is most people think falls are a natural progression of aging, and they're not. They can be definitely prevented if you take certain steps.
Well, I definitely agree. I think, what we also need to do is make sure we're active. And that's one of the things we try to promote here is being physically active. And not just going on a treadmill, but doing a variety of different things. If it's yoga, Pilates, make sure you're moving well, because a lot of these people just go out and they do walks, but they're really not stretching themselves, maintaining good mobility and function. And those are the things that allow us, we talked about, again, transfers, getting up and down, walking without an assisted device, making sure our balance is. And Troy said, we really have to keep an eye on balance, and we need to test that. Just like you go to see the doctor every year, you should be tested by your physical therapist. How's your balance? Is your balance maintaining an adequate amount, or we can give you some exercise or activities that you can do to help maintain a stable environment so you're not, susceptible to having one of these traumatic things.
Can I add one more thing
Sure.
to that? The other part with fall a lot of time is kind of the ego also. People will get and they'll lose their strength, they'll lose their balance, they'll lose their range of motion, and they find that if you find yourself at home and you're reaching for furniture to walk, number one is it's throwing your center of gravity off, and if you grab that chair, it's unstable, it can lead to a fall. Because 60% of all falls actually happen in someone's own home. The other thing is, if you're out in an open space and you're kind of wobbling around maybe from any of those 3 factors, maybe at that time you need a single point cane or a walker. Because what happens is people will lose their mobility, their independence to walk, and instead of going into a cane or a walker, they'll tend to just sit. And the more they sit, the studies out there show that over the age of 65, you lose 15% of your muscle strength per decade. So if you aren't active, as Dave said, a lot of times using that walker gets you more active and then gets you to the point where you can then be removed from the walker versus becoming kind of a couch potato.
One other thing I didn't bring up is common in the older population we see is vertigo. Mm-hmm. And a lot of people think there's, that's this, abstract thing that can't be treated, and it can be treated. A lot of the times we get patients that come in for vertigo, and they say, well, it's only when I get into bed and it only lasts a few seconds, but that can be the matter of, getting up in the middle of the night and getting vertigo and automatically falling down and having, something catastrophic happen. So vertigo is a very treatable thing. Some of them we can treat in 2 to 3 visits and, the symptoms are gone. Other times it might take a little, more involved treatment, but it's definitely a treatable thing, and to ignore it is, setting yourself up for, future fall.
So not only is taking preventive measures when we get older to falling, some things that we don't think about are shoveling snow. People get injured all the time shoveling snow, and we want to find out why.
Well, shoveling snow affects you much more than just conditions that we deal with in physical therapy a lot in regards to back and neck injuries. But you also have to watch your heart, because it is very strenuous being out there, lifting that snow. It's a heavy exercise. And if you're not one who's used to exercising, it can put a lot of burden on your heart, which can lead to a heart attack, as we usually see in news reports each year. The other thing that you want to look at, and the point that I always get out over and over again, is it's better to get out early and get out often when you shovel snow, because 2 to 3 inches, a lot of times if you have the correct shovel, you can just push that snow and you don't have to bend over and lift. and that will prevent a lot of back injuries. And lastly, that we could talk a little bit later is, everybody thinks of the activity itself of shoveling. That can injure me. But a lot of times, Dave and I will see that the person was out shoveling snow, they had no pain, but they were tired. So when they went back in their house, they kind of sat in their chair all relaxed with their hot or cold beverage, and then when they went to get up to move around, now they're stiff and they're sore. If they watch what they do after they're done shoveling, a lot of times you can prevent those injuries.
Absolutely. I think we really need to be, that's, again, prevention is the key. Let's get ourselves physically fit to do those things and learn proper body mechanics and the proper form, and make sure like Troy said, heart attacks, we hear them all the time, the winter woes of, snow. It really is, can be catastrophic with those type of, not preparation.
Now, you talked about how when somebody shovels snow, they relax, they have a hot drink in their hand, and they get up and they're in pain. Are there any ways to prevent this from happening?
I think posture is the key. I mean, when you sit and you should usually try to, when you do any strenuous activity, maybe shoveling snow, maybe lifting or carrying items, is you should look for a straight back chair versus those nice comfy sofas and recliners. And sometimes we have lumbar rolls that patients use, but you can just get a towel and roll it up the thickness of your arm and stick it right back behind your lower back, and it keeps that normal curve, which we call lordosis, in your spine that prevents injuries to occur at disc levels.
Yeah, definitely sitting is one of our worst enemies for everybody, and so it's really important to, not to slouch and get that posture and put those discs in a bad position. We always want to try to stand up and straighten up as much as we can and bend backwards to be counterproductive, counteract the forward bending that we do repeatedly when we're shoveling. So
you guys have been really great. I just want one more thing. Why is Restore Physical Therapy a place to go?
Well, I think it's a great place because we have a lot of experience. Troy and I have been, we went to PT school together, so we've been around for, it's almost 25 years now. But we've gone through the whole gamut of, variety of different treatments. We have a lot of things in our toolbox that we've always, working with new techniques and trying to find the latest out there. And I think it's great nowadays. We got the internet and we can do YouTube. So not only are we able to we've gone to a lot of courses, but now we're able to search the internet, and gives us a lot of good information out there. Some good, some not so good, but I think we're able to decipher that, and I think that's really helped us be one of the top places in the area. And that's, we strive to continue to, improve our abilities and skills and do what's best for our patients.
And I think what sets us apart a lot is our family atmosphere here at Restore. 60% of our referrals that come into the office are from previous patients coming back for other problems or referring their family members or their friends. And mostly it's because of our personalized care. A lot of people will use that buzzword, we give personalized, hands-on, one-on-one care. But what does that really mean, and what is that, and how does that present? At Restore, we emphasize more on quality versus quantity. So we're not jamming in 3, 4, 5 patients to one therapist. We're trying to keep the numbers low so we can really give that one-on-one personalized hands-on care. And we do believe, and it's part of our philosophy, of putting our hands on every patient that we see.
Well, thank you guys. And if anyone wants information on where to go and information about this place, where can they go?
Our website is www.restore-rehab.com. You can also follow us on Facebook, and we're also on Twitter at Restore PT. Thank you very much.
Thank you, guys.
Thank you.